Hey guys, welcome to the ATP project. You're with your hosts Steve and Nick.
That is Steve.
Steve. I said it with a lisp.
What was the lisp? Is there just simply not enough blood going to your brain at the moment?
That's probably what it is, Steve. Oh, you're just like the genius of you're the genius of the segues. So we're talking about hypertension today, Steve.
Hypertension.
Now, before you switch off and go, oh my God, how boring is hypertension? We wanted to talk about it because it's so common, and there's no signs and symptoms of hypertension. So it's quite a dangerous condition to have.
The silent killer. Now, does this mean I can wear my stethoscope here?
Yes.
And look
we
really
wanted
cool?
you to put the stethoscope on for the whole podcast. Steve,
Yeah,
so
that's
Dr. Steve. So you bought props in today.
I did bring props. I bought a...
Which is going to be great for the people listening.
This, yeah. This thing that goes in your ears and has got a funny 20-cent shape of that, and that's called a stethoscope. And you can use that you do blood pressure, or you can use this other machine, which is a sphygmomanometer.
Yes.
And it automatically does it. Now, you did yours before. Do you want to disclose your numbers? Because I'm going to disclose mine. I just did mine just before we started, and I've sent the picture to our video guy, Matt, who's going to put it on screen. I don't mind that, but it's got two numbers. It's got a top number and a bottom number, a systolic, a diastolic, and it's got another little number in there, and that's my pulse rate. So I can't remember what it was, 108 over 70, which is good for an old man.
Really. Pretty spot on, yeah.
And resting pulse rate of 66 before a podcast. And I'm not stressed, but I have to think about, because I'm going, God, how do we fit this all into an hour? But
no, because we've got a lot of papers on the table.
Yeah, and so do you remember your blood pressure, or do you want to say?
Mine's changed a bit. We did a couple of times. It was my last one. 79 over, what was it?
I don't know. You saw it.
I can't remember. It was low. I have very low blood pressure. I always have had low blood pressure for 20 years. Mine's very low. Sometimes it can be 90 over 60. Right. It's pretty low. It's pretty low.
It should be about 120 over 80 is the classic thing. Mine was 110 over 70, which is good.
Yeah.
Just regard the systolic blood pressure, and I'll relate to what it means with regards to the heart, because there's two numbers, and the systolic blood pressure relates to the phase of the heartbeat where the heart muscle contracts and pumps blood from the bottom two chambers. So you got four chambers of the heart, getting a bit off track. You got the top ones and then the bottom ones. The bottom ones are where all the muscle are, and the left side is the stronger one. It pumps the blood all around the body. The right side pumps it through the lungs to be reoxygenated. So that's the systolic. The diastolic, of course, is when the muscle relaxes in the heart and the chambers fill with blood.
Yep.
Just to give you what they mean, but basically it's a pressure, and it's measured in what they call mmHg, which is millimeters of mercury. Hg is the chemical symbol for mercury, and it's a liquid at room temperature, which the old blood pressure monitors in my day.
Well, that's what we learnt on in college.
Yeah, and you pump it up with liquid mercury.
Ones, yes. You watch the little thing go up.
Yeah. And then you slowly lower it down and listen with a stethoscope. It's around my neck now. I was trying to find it. And you can hear the starts to come through, and that's the top number. And So we. Yes, people think, oh, we're boring. But as we said, I'll tell you the stats on it. But we're also going to talk about some of the lesser known causes of hypertension. And it's not all about obesity and smoking and poor diet. There is other reasons. And I see it a lot in clinic, and I see a lot of people on blood pressure medication. So we're going to talk about natural solutions. Yep, good.
We're going to talk about foods that can be helpful as well. And we have to premise it by saying, do not go off any blood pressure medication until you talk to your doctor. So all of that stuff. But statistically wise,
what numbers is it? The American population is studied, and we're similar.
Yeah.
How many of those people have got hypertension? Is it about 2%, 3%? What is it, Nick?
So it's around about 45.6% in the US that have hypertension.
Isn't that incredible? Like
it's crazy. Yeah.
Pretty much like if there's, three in the room here, at least one of us has got hypertension.
Yeah. Yeah. It's nearly 50%, and it's very similar in Australia and other parts of the world. I did find the stats for all around the world. They were quite similar, with some variations, but overall, it was 1 in 4, but it is becoming now getting closer to 1 in 2. Yeah. It's getting worse. So it's quite scary. And as you said, it's a silent killer. There's no symptoms. So a lot of people are walking around, they don't even know they have hypertension, which is really dangerous because it can, if it's unmanaged and undiagnosed, it can lead to stroke, heart attack, kidney disease, vision issues,
What
sexual dysfunction, cognitive
was that
impairment.
one? Hang on.
Yeah,
I don't care
all
about the
the men will be
strokes
all
and
over
shit.
that.
Yeah.
Yeah, and cognitive impairment. So it can be like very serious, and it can be one of the most prevalent precursors to heart attacks.
Yes.
So it's a really serious condition.
All right. So my numbers, I've given you two numbers, 110/70. I'll round it off now. What's the danger zone? What are we looking out for? Where do we want it? What's a good number, etc.
I think that they're sort of amending it now to more 110/70.
So I'm perfect, in other words. Is that what you're saying?
Yes, Steve, you're
Just
perfect.
usual.
Everyone tells you how perfect you are all the
I am
time.
perfect,
You know that. We digress. So normal blood pressure, roughly 120/80,
Yeah.
110/70 is probably ideal.
Perfect. Just say perfect.
Perfect,
Yeah.
just like Steve. So elevated blood pressure, so pre-hypertension, sort of 129 and above sort of 80, so up to that sort of 89. Hypertension, so stage 1 hypertension is 130 to 139 over sort of 90.
90, yeah.
And then a hypertension stage 2 is above 140 above 90.
Wow.
So
it's funny because when I bought the sphygmomanometer in, I'm just going to call it Sphig from now on.
Yes.
Everyone's going, we'll test you. And I tested two women. One's about, I don't know how old she's, 40?
Yeah, roughly.
And one's 30, just turned 30.
Yeah.
The 30-year-old had hypertension.
Yes. I'm glad you said that because the 18 to 39 range is one of the fastest growing sort of like age ranges that are developing hypertension. It's the fastest growing. Like they're getting hypertension so much more commonly, so much more prevalent in that age range than it ever used to be. It used to be sort of a older person's condition, I guess, in air quotes. But younger people becoming really common for young people, which is very scary because, the earlier you get it, and if you have hypertension, and as we said, it's a lot of times there's no symptoms. And how many young people are going to be checking their blood pressure? Not really very many, I guess.
No one.
So, over the long term, they're doing damage to the arterial walls, which then is going to, predispose them to a lot of these chronic conditions and cardiovascular events. So down the track, So
if you get super high blood pressure, there are some symptoms to keep an eye out for, Nick.
Yes. So as we said, most of the time you don't get any symptoms, but if your blood pressure reaches dangerously high levels, you may experience things like chest pain, shortness of breath, back pain, numbness, weakness, headaches, vision changes, dizziness, confusion, nausea, vomiting, difficulty speaking. So you're pretty far up the path there if you've got any of those symptoms. But as we said, generally you won't really have any symptoms, which is why it can be so dangerous.
Yeah,
you'll be walking around with it and not know.
So it's called the silent killer for a reason. It's just don't know. So all right. So what are some of the causative factors? We mentioned obesity and smoking and all that. What are some of the others?
So there's two. So there's primary causes and there's secondary causes.
All right. Well, what's the primary ones?
So primary ones can be genetics. So there can be a genetic connection, which just because if you have the genetic sort of propensity towards hypertension doesn't mean that you're going to have it.
My dad had it and still got it to this very day.
Yeah, so lifestyle factors can definitely play a part, epigenetics, that type of thing we've talked about. Poor diet, as we've said, but we are going to talk about maybe some controversial parts of that.
Very controversial.
Sedentary lifestyle, we all know that. Caffeine and alcohol consumption, of course, they're stimulants, and we will talk a little bit about foods that can increase it and also foods that can decrease it. Obesity, as we know, but it doesn't. You don't have to be morbidly obese to have having extra weight impact your blood pressure.
Well, the young girl I measured certainly not overweight.
No,
not super. It's not. It's like you wouldn't look at her and go, "Oh God," she's just a normal woman.
Yeah. So even up to 5 kilos overweight can definitely impact your blood pressure. So it's not just overt obesity. Age. Again, as we said, that's now changed because a lot of younger people are getting hypertension. Sleep disorders, so sleep apnea is a really strong correlation between sleep apnea and hypertension. So, and I see it a lot in clinic.
And that's when you don't sleep well because you get adrenaline release to start your breathing again at night. Right. It's really sad.
Yes.
So quite bad. Okay, so that's very interesting.
And stress, Steve.
Oh, yeah.
So we're going to go into a little bit more about stress because I see in clinic this being one of the main drivers of hypertension because obviously when I see people, they're not coming to me and they're smoking and drinking and, eating bad.
Hope they're
not. If you're going to see a naturopath, you generally you're relatively trying to live a fairly healthy, balanced lifestyle for the most part.
It's true. Yeah.
So so there's little tweaks, but overall, stress is one of the worst drivers that I see of hypertension, and it's rife through society, right? Yeah. So there's and obviously there's the economic issue. So there's financial stress, you know, which creates relationship stress. So there's so many stressors in the world now. So it's a really prevalent problem. And it's really bad for hypertension, for driving hypertension. Wow. So there's, different types of stress. Yep. So psychological stress, Steve. Right. So or psychosocial risk factors we talk about. So psychological stress is said to occur if an event or environment demands are perceived as challenging enough to surpass an individual's capacity to cope.
That's a good definition of stress. I'm thinking, how do you define stress?
How do you define stress? Yeah.
Because stress, to people listening maybe doing what we're doing is stressful.
Yeah, everyone has different stressors and what they consider to be stressful. So you're exactly right.
I actually like this. I don't feel stressed at all.
I think it's fun. I don't find it stressful at all.
Working with you is a bit stressful, but...
Well, that's true. I mean, as we said yesterday, you've got a really sore back, Steve, from carrying me the whole time.
That's funny. But that's a great definition. Yeah. It's not what you do. It's how you perceive it.
That's right, exactly. Perceived stress is huge. So, but yeah, so challenging event, environmental demands, so there's stressors, So they can be different for everybody. So psychological stress can be different for everybody, but that can be an initial driver or a contributing factor to more chronic conditions, so autoimmune conditions, and then the cardiovascular disease, so including hypertensions and things like that. So that's really a really significant driver. Occupational stress, Steve.
Okay, what's that?
Yeah, so this is work-related stress. This is the second most frequent health problem impacting employed people in Europe. This is European studies. Approximately 25% of European workers experience work-related stress that negatively affects their health. Yeah. So high job strain. That's a really strong driver of hypertension. But you see it, I mean, I see clients who are in very high-powered jobs, running companies, things like that. If their stress is through the roof.
Oh, I used to run a company. It's the worst thing in the world.
Oh, I run a company. It's already stressful. But even people who are working for other, their employees, there's still a lot of stress. There's like, do they have good job security? Yeah. They've got low wages. Yep. Are they, there's a lot of issues for anybody in the workforce, really. Not in the workforce.
Cost of living crisis has gone up. Real wages have gone down over the last 3 years.
Yes,
so there's a financial shift. It's not that the wages have gone down, it's the real wages, which means they account for the inflationary. And again, that's out of our control, inflation. It's we can shop around that, but hopefully before this we were shopping around. But if the price of groceries and food goes up, then you just have to spend more. It's very stressful. And especially if you're sort of on a fixed wage, so you can't just magically make more money. No. So you just have to spend more, and it doesn't make sense.
It doesn't make sense. So occupational stress, only job related stress, is huge, and that's probably one of the biggest ones that I see in clinic. As I said, I see a lot of executives and things like that, and it's a really, really significant issue for them, and they have significant hypertension. So social, and this is what we were talking about before: social integration, social isolation. So this is the degree in which people feel connected to others in their group or the community. And there used to be a lot of community, but now there's really not now, again, because we're so segregated. We're losing a lot of that. So people with poor social integration have increased risk of developing hypertension.
Wow. And now I'm going to blame the internet for that a little bit.
Yeah, 100%. I totally agree. I think that's, because you can do anything online. You can have online communities now, but it's not the same. It's better than nothing, but it's not the same as actually, interacting with you.
Now, another stress in our lives, not mine because my wife's perfect. Stop laughing.
No, she is perfect. I'm laughing because she's dealing with you, Steve.
That'll be her blood pressure going up.
That's right.
But marital status.
Yeah, marital status and quality of the marital relationship is another stressor, really significant stressor.
We're all in relationships here. We've got to be very careful about this bit, just a warning.
Yeah, I know. So high marital quality is found to be associated with lower stress, lower blood pressure at home compared to when they're at work. Or so intermediate marital quality or not having a partner can in some cases increase your blood pressure also or decrease it, depending on where you sit with that. So this is a study. Although married individuals had a greater nocturnal drop in blood pressure than single individuals, so nighttime.
Yep.
Singles fared better than people in low quality marriages.
Oh, yeah.
So usually there's a 10 to 15% decrease in blood pressure at night generally. And in the absence of nocturnal dip is associated with target organ damage. But, yeah, people in unhappy marriages goes up.
Jeez, I've got to check back tonight's blood pressure.
So, there's a lot of people that have been, look, I was in a very unhappy relationship for a while ago, and, it does impact your health, so you just got to leave.
Yeah.
I did. Now I have a great partner. Anyway. But, yeah, that can be a big problem. And, people that have been married for a long time, it's hard to sort of separate, I guess, and there's the financial stuff, so they deal with it. So it can create a lot of issues with increased hypertension. So, relationship status.
All right. Well, what else can cause blood pressure to go up?
Low socioeconomic status.
Okay,
obviously.
so
that's because we sort of talked a little bit about that, economy, that sort of thing. And negative affective states.
Right.
So anxiety and depression.
Yeah.
So they might develop. They might be they can be a cause of stressors, but they can create hypertension, and then hypertension can also impact anxiety as well.
Yes.
So it can go both ways.
Of course.
But yes, psychological stresses can contribute to the onset of high blood pressure. So your anxiety and your depressions and things like that. So, divorce, like big life events, divorce, unemployment, death of a partner, a relative, or anything like that.
Yep.
So depression is associated with blood pressure progression and increased cardiovascular morbidity and mortality risk.
Wow.
So if you have chronic depression, it can definitely lead to cardiovascular issues, including hypertension to begin with. And then anxiety, obviously, have hypertension, and it can go, again, with anxiety, it can go both ways. Anxiety can create hypertension, and hypertension can also make you feel anxious as well. So it can go a little bit both ways.
Yeah, there's an event called a Takotsubo event, which is a sudden increase in blood pressure due to your death of your partner.
Yes.
And it's called broken heart syndrome.
Yeah.
And you see this a lot in elderly couples where one of the partners dies and then the other one dies pretty soon afterwards. Takotsubo, Japanese.
Yeah, it's very common.
I don't know what it means in Japanese, but it's very sad.
It's very sad. I don't think I've ever disclosed this. I was widowed at 31.
Oh, yeah.
And I can tell you the stress of that was horrendous. Horrendous. So, yeah, I can vouch for that one.
Yeah, that would have been horrendous.
So, and here's another one for you, Steve.
Yes.
Anger. I'm putting this one in.
What are you saying?
I'm putting this one in because...
I've still got this on. What is that? Snake on me. I've still got my stethoscope on. It's just to press people. It's not working, is it?
No, it's not. No, you don't need to. You already impress people enough, Steve.
Yeah, my gorgeous blood pressure.
That's right, exactly, yeah.
Perfect blood pressure, sorry.
Exactly. Anger. Anger's, I put this one in there because I see this a lot.
Yeah.
A lot of people have anger issues that really they can't control.
True.
And they can be quite significant. I'm going to say men, but don't want to generalise. There are a lot of women that have anger issues as well. What did you say?
So you're got to pick on men, don't you?
I'm going to pick on men. But I'm actually not picking on men because some women do have anger issues as well. And that's that explosive anger that it just comes out. And I knew somebody who was in my world that had this issue. And they would just go red in the face. They would, look like something was going to pop in their head. But I'm talking that sort of anger. Really bad for blood pressure. So even though it's not chronic hypertension, every time they have this explosive anger, their blood pressure goes up, and if it goes back down. But it's the continual up and down, so that just wears away at the arterial wall and then creates problems,
damage,
right? And that's the thing, like we talk about like life, but life is short, and you're pushing yourself, and you're like, I see it all the time in clinic with, say, executives, and they're like, yes, I see you've got to work on your stress management. You've got to pull back a bit. Yes, but I'm running this company. I have all these people under me. I have a project I have to complete in the next 6 months. I've got all these things happening. I can't at the moment. And the old, well, what can I take just to help me?
Yeah.
But if you drop dead of a heart attack, or you have a stroke because you've got this hypertension that's just going on too long, what's the point of it all?
Exactly.
So you've got to really weigh it up a little bit. But you're back to the anger. So a lot of people, they're just like, I don't know why. I just get so angry and I can't control it, and they just go, ugh, and they literally look like they're going to have a stroke sometimes. It could be your genes, Steve. I know we're talking about hypertension here, but I thought I'd just throw this in.
I'm wearing slacks today.
You are wearing slacks today. Yeah, good point. I'm wearing denim, not jeans though. Anyway, the MAO gene, Steve.
Mayo. So isn't that something that goes in a hamburger?
Yes, that's
monoamine
right.
oxidase.
Yes. So it helps the body in process neurotransmitters, a couple of neurotransmitters.
Yeah, dopamine and adrenaline, noradrenaline.
And dopamine. So these help, these are sort of part of the fight or flight response.
Yeah, they're vasoconstrictors too.
They are, yes.
So that's the adrenaline pathway.
Yes.
And adrenaline constricts your blood vessels, which puts your blood pressure up.
Yeah.
So if you've ever been to the dentist, had a filling, they inject you with lidocaine and adrenaline.
Yes.
Squashes the blood vessels, stop bleeding in your gum.
I'm not breathing, just
not bleeding. Not bleeding.
Breathing.
So if you can't break down those adrenalines, you get more adrenaline floating around. You get more, Yeah,
exactly. And some
anxiety.
people have this gene polymorphism. So they're the MAO. So if there's a MAO and MAO, MAO-A and MAO-B.
Yep.
But some people, their gene can act too slowly. So they have a build-up of these neurotransmitters.
Yeah.
So they have a lot of this anger that they can't control this anger. So it could be your genes. If you have someone that does have an anger issue, but really, really bad for blood pressure, and that's sort of up and then the down and up and the down, really quite bad. So if you do have an anger issue, maybe look into your genes. So I'll just throw that in there just for something.
Well, Nic, you mentioned this thing called primary hypertension.
Yes.
Now, there's things there's secondary. It's called secondary hypertension. What are the things we've got to look out for that drive up?
Yeah, so secondary hypertension affects about 5 to 10% of the population, so it's a lot lower. And it's usually from an underlying medical condition.
Right.
So kidney disease.
Yep, kidneys regulate blood pressure.
Yep.
Keep it simple. We haven't got time to go into that, but that's a good one.
Yeah. Sleep apnea, as we said earlier.
So if you're, and it's usually the guy that has this, and women have too, but
I see
if you
women in clinic that have sleep apnea.
Yeah.
But you do hear a lot more men that have it.
And so if your partner, male or female, has got this thing where they go, like this thing at night, that's sleep apnea, and that you at least check their blood pressure.
Yes.
It's free and easy and quick, and you can do it in 5 seconds at a pharmacy or whatever, but check them out. So good point.
Definitely. Yeah. So hormonal disorders as well.
Oh, yeah.
And here's one for you, Steve. Some medications.
Really?
Yes. But medications that you might not think, well, those are very common medications. So here's one that is very common. So your NSAIDs, non-steroidal anti-inflammatories, so things like your ibuprofens, paracetamols and things like that, they cause the blood vessels to narrow.
Right. So we're talking even the prescription drugs, the Celebrexes, the Mobix, the Oritus, the indomethacin, a few of those sort of naproxens. They're highly kidney toxic too. So there's a relationship with that.
Yeah. So there's the kidney.
Okay, so that's one drug. Yep.
So
ibuprofen too. Everyone takes that.
Yeah, a lot of people take NSAIDs. So I mean, they're doing stuff to your guts anyway. But now they're affecting your blood pressure as well. Decongestants.
Okay, so things like pseudoephedrine.
Yep.
Okay, which sounds like epinephrine.
Yes.
And that constricts blood vessels, and that's how it stops your mucus. Actually, it constricts the blood vessels in your nose, so you don't get runny nose. And if you take it a little bit, and it's all right. But there's people who take too much of that stuff.
Yeah, I mean your NSAIDs, your decongestants.
Yep.
If they've got
very common.
Yeah, very, very common. Now here's one that's scary.
Yeah.
The oral contraceptive pill.
Not scary to me.
Or oral contraceptives. Particularly the estrogen part of that. So birth control. So birth control pills. So Yeah, so more so in women over the age of 35, it seems to be.
Right.
But yeah, really, really common.
Wow.
And that would also extend to HRT as well in some people. So the estrogen
Hormone
factor in
replacement therapy, yeah.
Yeah, exactly. So, but how many women are on contraception? Like,
Or HRT.
Many. Or HRT, yeah.
Loads of them.
Loads, yeah. So that's something that maybe people wouldn't associate. So why have I got why is my blood pressure going up and up?
Yeah.
Could be that.
Huh.
Antidepressants. So
everyone's on them now.
right. So depression, anxiety, those sort of things can impact our blood pressure, as we said, and then the actual drug to treat those conditions can impact our blood pressure as well. So
wow, yeah. So just a bit of mechanism there. Most antidepressants work on a chemical called serotonin.
yes.
Serotonin is a vasoconstrictor. So it squashes your blood vessels. When you, think of a hose, squash the hose off, the blood pressure goes up.
Yeah.
So even you could add to that any of the other serotonergic drugs like triptans for migraines.
Yeah.
In fact, the way they work,
That's how they work. Yeah.
they squash the blood vessels in your brain.
Yeah, exactly.
Because you've got 7 different serotonergic receptors. The B1B, is the one that squashes the blood vessels.
Yeah.
Sorry, going off topic a bit. But anyway.
That's good. And then steroids. And we're not talking we're not really talking about steroids you do outside of the doctor's office, but some steroids that people need to take for certain conditions. So they very, very commonly will increase blood pressure.
So even corticosteroids.
Yeah, corticosteroids, really common.
Yeah.
Yeah, because what do they do? Cortisol retains sodium.
Yeah.
Sodium increases your blood pressure, obviously.
Okay.
And even some herbal supplements.
Oh, no.
Yeah. One of the big ones is licorice.
Licorice.
Yeah, one of the big ones. I'm really cautious with licorice. I always use deglycerized licorice because it's the glycerin part of the herb that actually retains that sodium, which then pushes your blood pressure up.
Yep.
So people that are taking licorice supplements, like, I have so much stress. I take for one, if you've got high cortisol, do not take
Yeah,
licorice.
you don't want to take.
Do not.
No.
Only if you have so licorice should be good for me, but I can't take it because I get very severe fluid retention if I take licorice.
Wow.
I'm sensitive flower. But that's one of the big ones. And then obviously, you're very stimulating herbs as well because they're increasing cortisol.
Yeah.
Yeah.
Ginsengs,
Ephedra.
guarana.
Yeah, guarana, those sort of things. So if you're on medications, any of these medications, and you have blood pressure issues, let's have a look at that.
Have a look at that. Speak to your doctor. All right, let's get to the fun bit. What about foods?
Yeah,
we need to talk about foods and what people are commonly consuming that cause problems with hypertension.
Yeah.
And I want to get to the elephant in the room, sodium.
Yeah, sodium. So sodium's the big one. It's like going to low sodium diet. So the DASH diet is one that's recommended. So
what does DASH stand for?
DASH stands for Dietary Approaches to Stop Hypertension. So it's really technical.
Right. Okay.
But because it's low sodium and that sort of things, everyone's like, I'm on, have high hypertension. I need to avoid sodium. Well, no, the majority of people are on highly processed foods that have a lot of people have hypertension having a lot of highly processed foods, which are very high in sodium. So if you're having a whole foods mostly unprocessed diet, then you're okay. Obviously don't layer everything with salt.
No.
But a little bit of sodium. But sodium is a really big one and it can be problematic.
It can be. I mean, absolutely. And especially if you're on a high carbohydrate diet as well.
Yes.
Because what we know is when you eat a lot of high carbohydrates, there's a study done here and it's published in the American Journal of Clinical Nutrition a few years ago. They gave 2 groups. One a low carbohydrate diet, 13%, the other one 52%, which is a high carbohydrate diet. And they found that changing carbohydrate intake caused a rapid inverse change in urinary sodium excretion by balance. So what they found is when you have high carbohydrates, it stops sodium excretion and causes sodium retention.
Yeah.
So you get massive hypertension.
Yeah.
So, you got to be careful of that. So
that's why when people who go to a low carbohydrate diet suddenly lose all this fluid.
Yeah.
Because it does retain fluid.
Absolutely.
So a high sodium, high carbohydrate, refined carbs and things like that really can be quite detrimental for your blood pressure.
Amazing.
Energy drinks, obviously, which is really prevalent now. I mean, you see people walking around with kids with V's and Monsters and whatever. I'm not going to say the brand names, but really bad because they've got the caffeine in them. So anything stimulating, as we said, increases cortisol, retains sodium. So it can be quite dangerous. So,
another paper quickly, current nutrition rep 2019. It's not going to shock you. Excessive sugar intake from sugar-sweetened beverages associated with higher blood pressure and other stuff that we're not going to talk about today, but really bad stuff. So
yeah, really bad.
I think we would quote a study on that, so that's interesting.
And licorice. I know we talked about the herb licorice, but there's licorice lollies, licorice sticks. You know, I used to, when I was a kid, my mum used to work above a health food store. So I'd come home from school. I'd go to stay there after school and I'd go through the health food store and I'd get a chocolate-coated licorice stick on the way. I love them.
Bullets and those sort of things. They're called bullets. They still called bullets, or is that politically
correct? Yeah, I guess. I don't mean, but yeah, bullets are bullets.
Yeah.
You can get licorice lozenges and things like that. But if you have too many of those, it increases your blood pressure. So you have to really be careful. I did read of a case once where somebody was having licorice sticks every day and they had significant hypertension because they're having too much licorice. So and gum, like licorice gums and things. You got to really be careful with licorice. So that's interesting. So we will talk about foods when we talk about treatments to lower blood pressure as well, but they're just a few of the foods that can be a factor. But here's another one for you, Steve, because we always hear about, well, if you've got hypertension, cut out your red meat.
Yeah, of course.
Red meat's terrible for hypertension. It's terrible.
Sin.
It is a sin. But you have a study in front of you, Steve, that says otherwise.
Oh, it's not just a study. It's the Framingham offspring study. Adults.
Huge. I mean, there was the Framingham study. So this is the continuation
Offspring.
and this is their children now. This is how long this study's been going on for.
And it's in the American Journal of Hypertension.
Yes.
Pretty big one there. And what they found was that, and basically, I'm just going to go straight to the conclusion. This is a massive study. What they found was adults consuming more dietary protein from either plant or animal sources had lower long-term risks of blood pressure, high blood pressure.
Yeah.
Now, so protein has this inverse effect of reducing blood pressure. Now, one of the mechanisms is by which when you ingest proteins, one of the amino acids is arginine. And arginine turns into nitrous oxide, which is the little gas inside your arteries which dilate them.
Yes.
So it causes vasodilation.
Yes.
So we're starting to get a picture here of that maybe, that it's not what we were led to believe. And as you know, that hypertension's gone up. And we've been able to measure it for years. Blood pressure's been measured for years. So this could be a falsehood there, that we now know that protein is not the main cause. But what about saturated fat, Nic?
Yeah, well, I was just going to say on protein.
Oh,
we did talk about it earlier. We sort of touched on it before we came into the podcast. I think a lot of the people with hypertension, a lot of times were having not the best diets. So they're having highly refined foods. They're also having not the best quality red meats, charred meats, highly processed meats and things like that. So I think that's where the lines get blurred.
Correct. Yeah,
so
they do.
if you're having a nice minimally processed whole foods diet with some red meat in there, maybe some grass-fed red meat 3 or 4 times a week, that's completely different. And I think that's where people get the lines a bit skewed and go, oh, red meat. No, it's not. It's the quality of the red meat, how it's cooked, whether it's processed and what it's paired with, which is generally highly processed things.
Well, you got to think that meat, when they did the American, which made the studies, they'd look at hamburgers, pizzas, and it's like, is that the meat or is it the
There's
chips you have?
There's no distinction between a healthy diet and the unhealthy meat. The meat is just in there no matter.
Yeah, so a little bit of thing. But there's an interesting study here on saturated fat.
There is an interesting study here.
And it's published in Nutrition 2019.
Yeah.
And I'm just going to go straight to that because we've got to talk. What they did was they looked at 585 Japanese 40 years and older. So the demographic that are us that increase, that have high blood pressure more than anyone else. And they said that, and I'm just going to quote the conclusion here, it says, saturated fatty acids contribute to the prevention and treatment of hypertension in elderly patients. So, saturated fats are bad for your heart and all this sort of. We talked about this in the cholesterol thing. It's not a drama there. It's not a drama because it depends on the saturated fat and if your body makes it. But it actually reduces blood pressure in older people.
That's right.
And they define hypertension as anyone 140 over 90. So that's the definition. Yeah. So very interesting, isn't it?
It is. I mean, it's like, again, like the meat, it depends on the quality of the diet. If someone's having a lot of saturated fats that are really dirty saturated fats and they've got processed foods around that, of course, that's where the correlation comes in, but it's not causation. So if you're on a whole food diet, a little bit of saturated fat is okay.
Oh, good old coconut's the highest source saturated fats. That's good.
Steve.
Oh, well, what do you do about it? Yeah.
What do we do about it? So, should we talk about how you actually take your blood pressure first? Because there's ways to take it.
There is.
So you don't just take your blood pressure randomly and then go, oh, it's high or it's low, I'm good. So you need to take it a few times.
Yes.
Take it, and you take it on both arms.
Yep.
Not just one arm all the time, so you can get a really good reading. You have to relax before it, so you take some deep breaths. Sit down, put your arm on the table so it's around about heart level or just below heart level.
Yep.
And there's the whole white coat syndrome as well. So people go in and they get nervous. We know someone around that gets white coat syndrome.
Really?
Yes, we do.
So tell me who that is later.
Anyway.
Oh.
Yeah. So that can be a factor as well. So if you do, every time you go to the GP and you get your blood pressure taken and it's high, get it done, take it at home, and then you can see whether it's actually an issue or not. And you can get blood pressure monitor. I'm
going to hold one up to the camera.
Yeah, from the chemist.
I got this from the chemist.
Yeah, $80, $60.
Yeah, it was like that.
I think $50 even.
Yeah.
And you can take it at home. So taking it at home is obviously a much better way to do it because
you can do your partners and your friends and family, and
you can do it regularly.
And all you do is put it on your arm and press a button, and sort of
literally that's what you do.
And it comes up with a number. So you can't fudge it. Like in the old days, you had to listen and stethoscope it and all that crap, but you don't have to.
No, it's super easy. So if you're having a stressful day, take your blood pressure and see what actually that stress is doing to your blood pressure. You'd be surprised.
Don't do the old classic is, I'm not going to take it because I'm stressed. It's like, that's when you take it.
Yeah,
that's when you take it.
And that might spur you on to do more stress management activities and things if you're noticing what the actual stress is physiologically doing to your cardiovascular system.
God. All right, Nick. So all right, well, I've taken my blood pressure. It's high. I know I should do stress, diet, lifestyle, blah, 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 blah. What can I supplement my diet with to help with this process?
So there's heaps of really good nutrients and herbs that can actually help to reduce blood pressure.
The first one in your study is my favourite probably of all of them.
Yes, very easy. And it's
so easy.
It's relatively inexpensive.
This is the thing I gave my sister too.
Oh, there you go. Magnesium.
Yeah.
Super easy, and it does so many amazing things in the body. It's great for nervous system function, obviously.
Yeah, loads. But here's the thing, you need magnesium anyway.
Yeah. So really, really good at reducing blood pressure. So it's a cardiovascular regulator which maintains electrical, metabolic and vascular homeostasis. So very good for hypertension.
Oh, look, it was one in this little study I got here published in Nutrients 2021, and it gives you the mechanisms by which magnesium reduces blood pressure. I'll go through them quickly because there's 7 ways that it reduces blood pressure.
Yeah.
First thing, it's a calcium antagonist. So it stops calcium going in the blood vessels, which constrict them. Yep. So it's a calcium channel blocker. It helps with endothelial dysfunction, which is the inside of the arteries. It helps them heal up. It reduces oxidative stress. It reduces low-grade vascular inflammation, reduces insulin resistance, and insulin is a kicker for the blood pressure. It reduces vascular aging, such as atherosclerosis, and also remodels the vascular system. So
it does it all.
It cooks your brick, and there's magnesium in there.
Yes.
And I didn't do it for the podcast. I just like it.
Yeah, so amazing. And, I put a lot of people on magnesium. And you could do, I've done super high dose magnesium, so it's up to 700 milligrams a day. Some people go higher. If you have issues with constipation and you're taking magnesium oxide for constipation, it's not really going to do much. It doesn't absorb overly well. Great for constipation. That's why it works with constipation. But magnesium orotate specifically, Steve, good for cardiovascular health.
Oh, yeah, that's a beautiful one.
So that's a really good one to get. And you can mix them all up. So you can do your citrates and your glycinates and your L-threonates. You can mix them all together, Steve.
Well, if you do and you have like a glycinate and threonate, you take it in the evening before you go to bed, gives you magnesium while you sleep.
Exactly, which then helps with blood pressure as well. Because keeping it stable overnight. So magnesium is really good. And I'm going to talk about this one next because you pair it with magnesium is coenzyme Q10.
Coenzyme Q10, ubiquinol.
Ubiquinol, Steve, ubiquinol.
Yeah, it's the best
definitely.
one.
It's a really good hypotensive, so it's good at reducing your blood pressure down. It's an antagonist of vascular superoxide, which is
free radical,
so very bad for inflammation and
it destroys
stress.
nitric oxide. That's the thing. It grabs onto that and forms the peroxynitrite free radical, which is even more dangerous.
More dangerous, exactly. So as I said, antioxidant, that sort of thing. So increases your nitric oxide bioavailability, all that sort of stuff, and magnesium orotate
Yep.
lifts it in the mitochondria as well. So if you're having CoQ10 for hypertension, awesome. Pair it with magnesium orotate.
Yeah.
You'll actually get a much better effect from the CoQ10.
Nice.
So pair them together. It's really good.
Yes.
So CoQ10 up to 300 milligrams a day is a good dose.
Yeah.
Omega-3 fatty acids. I mean,
it's good for your heart.
them, so,
the good thing about all these things, they're great for blood pressure, but they're also got side effects that are good for you.
there's so many amazing, anti-inflammatory.
Yep.
So the omega-3 fatty acids improve arterial elasticity.
Oh, you want that.
Reducing that stiffness, arterial stiffness, obviously. Reduces inflammation, platelet aggregation, and vasoconstriction. Very good for that. So omega-3s. Here's one that I love. I do this one a lot for any hypertensive issues is taurine, Steve.
Yes, that's a beautiful amino acid found in animal proteins.
I love it. So it's very good for nervous system, balancing the nervous system. So any sort of anxieties and things like that. So it inhibits antidiuretic actions of vasopressin.
Whoa.
It acts on central nervous systems, obviously, as you said, so it helps to reduce any sort of cortisol and adrenaline and that sort of thing for the adrenals. So that's a really, really good one. I put that in a lot, taurine, and a lot of times you can find it paired with magnesium as well sometimes.
Oh, yeah, absolutely. I've seen them together.
Yeah. L-arginine, as you said, I think, did you say earlier?
Yeah, I did say earlier that it makes NO.
Proteins.
Nitric oxide.
Yes, it's a vasorelaxant, contributes to, as I said, nitric oxide production.
So good.
Supports renal function, which is really important when we're talking about blood pressure. So, and then N-acetylcysteine can also be really good as well. Improves endothelial function.
Yep.
It reduces homocysteine. So homocysteine is something that can be a significant factor in cardiovascular events. And it's not regularly checked by the GP, and I think it should be.
Homocysteine.
I think it should be, So B12, folate, B6, B2, you need to support that methylation cycle.
Yep.
So homocysteine I think you should check your homocysteine levels standard. But if you have hypertension, check your homocysteine levels. You may have to pay for it. I think it's about $30 if your doctor won't do it.
The doctors, it's a funny one with GPs. I don't know about homocysteine.
Yeah, I mean, Medicare's really messed things up. But anyway, so N-acetylcysteine can be really good as well. So 600 milligrams 3 times a day. Good.
So
1,800 milligrams. I sometimes split it, 900 twice a day. Alpha lipoic acid, very good at normalising the systolic blood pressure. It's an antioxidant, improves nitric oxide synthesis. It inhibits endothelial vasoconstriction.
Jeez.
So it's a good one. Vitamin E and vitamin C, pretty standards for cardiovascular.
We know that one.
It just does so many things. Antioxidant, nitric oxide, by synthesis, all that sort of thing. What else we got? Vitamin D is really good as well. And then your folate, B6, B12 for that that methylation cycle. And
what about some herbs? You got any killer herbs for us?
I do have some killer herbs. Well, they're not killer herbs. They're
prevention killer herbs.
So this is the classic cardiovascular herb is hawthorn.
I love it.
It's really good. So it's peripheral vasodilator and hypertensive. So it's mild hypertensive. It's antiarrhythmic as well. So anyone with arrhythmias. Reduces heart rate variability. It's an antioxidant. So it's a tropo-restorative to the heart muscle, which helps restore the muscle, the heart, which is really good. It's an anxiolytic. Obviously, that anxiety that comes along with it. So hawthorn is a really good one. Dan Shen is another good one.
Sativa, I love it.
Yeah. So this one's really good. Hypertensive. It's a vasodilator, cardioprotective, antiarrhythmic. Really, really good. Garlic.
It's good for vampires to keep away and everything.
It is, as we said, we've never seen a vampire.
Halloween's coming around the corner. I'm going as Dracula.
Hey, what are you going to what? Are you going to
just a social event, with the Ford.
If anyone wants to invite me to a dress-up party, I've never been to a dress-up party. I would like to go to it. I tell a lie, I went to one.
What would you dress as?
Well, it depends what the theme would be.
What about Halloween?
Oh, Halloween. I don't know.
A witch?
What about it? Well, I've been called a witch many times. No.
All right. Herbs, Nick. What
garlic.
else?
So garlic, really, really good. It's so many amazing actions garlic has for so many different things, but definitely for high blood pressure. Astragalus is another really good one that I love. It's a good vasodilator.
It's good for the kidneys too. And
nitric oxide booster.
Yep.
Ginger.
Oh, see, that one surprised me when I saw this.
Yeah. So this one, this is comparable actions to calcium channel blockers.
Like Femprenil, which is a drug.
Calcium channel blocker medications, exactly, ginger. So amazing. Devil's claw.
I didn't even guess that one.
Hypertension.
I use that for arthritis and stuff.
Yeah. And one of my favourites, Steve, berberine.
Oh, yeah,
I love berberine. So berberine has hypertensive actions. It also helps it's lipid lowering. So obviously the whole cardiovascular impact there. So, high cholesterol, that sort of thing. It's anti-inflammatory as well. So that inflammation that comes along with the endothelial issues.
Yep.
Blood sugar regulation. So there's the issues with the insulin and that sort of thing that comes along with hypertension. So I love berberine, very good for the gut as well. So if there's any issues that are gut that are causing inflammation, activating the stress response, causing higher blood pressure, that type of thing. So berberine's really good. But there's just so many things that you can do that are so effective. And I've seen it so many times in clinic, been able to get blood pressure down. And then I tell people to go back to their GP because I tell them to monitor their blood pressure. If you're on blood pressure medication and you want to try some of these things, either work with a practitioner or do your due diligence, make sure everything's no contraindications or minimal, and just monitor your blood pressure and talk to your GP, obviously, about it as well. And if your blood pressure starts to reduce, you can go back to your GP and talk to them about maybe reducing your medications, or a lot of times your GP will say, get off the natural stuff because they're causing your blood pressure to go too low.
Well, that happened to my father years ago when I got him on magnesium. But the thing is that you've got to be careful because you don't want too low a blood pressure either.
No, you'll get up and fall over.
Well, yeah. and unfortunately, blood pressure is a difficult one to track if you haven't got one of these $50 things. But I would advise, as I said, my local pharmacy has one there. You can use it for free.
Yeah.
But check it. It's called the silent killer.
Yeah.
For a really good reason. Too much pressure around your arteries, eyes, and
you don't want to get a stroke, or you don't want to get a stroke. Foods. So nitric oxide boosting foods, Steve.
Ooh, nitric oxide. That's the stuff we want in our arteries. Yep,
exactly. Beetroot's probably one of the most well-known ones. Beetroot's really good. Rocket or arugula if you're living in the US.
Tastes like peppery, yucky stuff. But anyway.
I love rocket. I put rocket in my smoothie every morning.
Oh.
I love it. Good for bitter. It's good for the liver.
Yeah, it's bitter,
digestion.
All right. Yeah.
Spinach.
Yep.
Coriander, which has some amazing benefits as well. Basil.
Yep.
Celery is a really good one. Obviously, parsley. Parsley is a good heavy metal chelator.
Ooh, good. Lactopic acid. I meant to say that earlier, but too late.
Oh, too late, yes. Yeah. Radish.
Yeah.
Butter lettuce.
Yep.
Bok choy.
Nice.
Beet greens.
Yep.
Which we don't really eat them in this country so much. No. Kohlrabi, which is becoming more common. You can get that in fruit shops. I see it all the time. Swiss chard.
Yep.
Leaf chicory.
Yep.
And then your beetroot. So you could make great salad out of that. Put your parsley and your basil and your coriander in there, and so if we're going through a day of someone with hypertension, the first thing is obviously the stress things, but let's just talk about diet things at the start. So manage your stress. So get up, maybe do some light exercise, go outside, get some fresh air, go into nature, walk your pet, which we didn't talk about. It's a study here
pets.
On pets.
I know, I printed out some studies on that. You can finish that one. Just for my
benefit, you put in the...
I did.
So mine pets causes me stress, but that's okay.
Pets are a great way to reduce stress, even cats and dogs.
Yeah, really good. So get up in the morning, go for a walk, which reduces cortisol. You're getting the sun, so you're helping your circadian rhythm, which helps you sleep better that night. You're walking your pet, which is also reducing your stress.
Yep, you drink up and have a drink of water and magnesium in it.
And then you come back and you make a smoothie, Steve, with some rocket, some celery, some herbs in there.
Yep.
Perfect for anyone that has hypertension.
Put some nuts in it for the arginine if you want to bulk it up, like LSA.
Yep, exactly. Maybe have a couple of eggs.
Yeah, good.
That sort of thing. So it's a good start to the day, and it's going to help.
It's a great start for the day. Lunch, you can have your green leafy vegetables if you want then, or you can have something more substantial, green vegetables, something like that. Really good. Of course, take your supplements again. Try and space magnesium out throughout the day.
Yes, definitely. Yeah.
So again, magnesium supplements and all the other ones we mentioned, too many to mention. But your morning walk, get out in the sun, get the vitamin D, and that's good for your brain.
Yeah, and then do your other exercise, any other exercise throughout the day. If you do a little bit of walk after lunch, lunch.
Yep.
It's something to help with your blood sugar regulation.
Oh,
It's gonna
yeah,
help with
that's
blood pressure
really
as well.
good. I saw a study on that.
Yeah.
yeah.
So there's so many things you can do rather
Yeah.
than just taking the medication and then that's it. Like medication, yes, 100% get on the medication if you need it, but then change your lifestyle, bring in some of these lifestyle factors like your diet and your exercise, things like that, and then work with somebody to help with these natural solutions, and you can work with your GP, reduce your medications because that has its own issues as well, side effects and things.
One of the side effects of propranolol, which is like a beta blocker, is exercise intolerance. You literally can't do any more exercise above a brisk walk.
Yes.
You physiologically, your adrenaline doesn't work.
Yeah.
It's a weird mechanism of action.
It's really bad, and I've seen clients in the past where they're really struggling with a lot of side effects from beta blockers, and one being they can't exercise, they're breathless, they're shaky. So yes, and apparently I didn't bring the study in, but younger people that are on hypertensives, antihypertensives, they don't work as well as if you're older, so over 60 or 70, I think it is. So, and that's what I see in clinic. I see people still have high blood pressure and they're on blood pressure medication. So obviously if they weren't on it, it'd be even worse. But you just start doing some of these lifestyle things. Get onto some magnesium's easy to get onto. Get onto some magnesium orotate, really good. Monitor your blood pressure, obviously, if you're on any of these things. But there's really easy ways to reduce it.
Yeah.
So, and super important, and check it. If you've never checked your blood pressure and you have a fairly stressful lifestyle or high pressure job, things like that, check it because you might be walking around as a bit of a time bomb and not even know it.
Wouldn't even know it. Silent killer. And you could be really stressed, like you could even own a German Shepherd or something. That could make you really stressed.
Yeah, you could, and they are stressful. Yeah.
Well, on that note, Nic, I'm going to fill up my magnesium bottle.
Yes.
And I'll see you next week.
Yeah. See you guys.
See ya.
Bye. FAQ, Steve.
I love it. Let's go.
Time of the day. Emily from Melbourne says, Hi ATP team. I've been following your podcast for a while and I've heard you mention Shilajit a few times. We do love Shilajit.
Oh, love it.
Great. I'm really curious about how it works, especially for women. I do get this question a little bit. I've been struggling with irregular periods, mood swings, and my skin has been breaking out more than usual, especially around my chin and jawline. Could Shilajit help balance my hormones? Love to hear your thoughts.
It's a really good question. We actually did an entire podcast just on Shilajit and how it benefits women. In fact, there's lots of studies on that. So it is good. Like a lot of people know Shilajit I won't call it a herb. It's an oozy, blacky resin that comes out of the mountainside. It's got 85 different minerals in it and fulvic acid and humeric acid and all these other weird acids in it from broken down plants from thousands of years ago. But it's extraordinarily beneficial for both men and women. It's a great revitalizer. So very much helps with any sort of condition you've got. Really, it's one of those, not I won't say cure-all, but I'll say help-all because it really does help the body. So very, very good for women as well. And we have done studies, and there was one in our podcast about how it helps the skin.
Yes,
so
definitely. That helps the skin. It helps increase FSH and good for fertility for women as well. It's with ovulation, things like that as well. So
about half a gram a day is what they recommend.
Yes. So
all the studies are on that.
Definitely. It could be a really good one.
So that's a good one.
Get into some Shilajit.
Yeah.
All right, here's another one for you, Steve.
Okay.
This one's all you because this is that's way out of my wheelhouse.
Oh, really? I haven't even read it.
I just saw the word and I went, oh, this is you. Okay. Oliver from Canberra.
Oliver.
Hey, Nic and Steve. I'm a big fan of the podcast and all the awesome advice you guys give. Oh, thanks, Oliver. I'm currently training for my first marathon. And while the training is going well, I'm starting to worry about avoiding injuries as the intensity increases.
Yeah.
I've had some minor joint pain in the past, especially in my knees and ankles, and want to make sure I stay strong and injury-free leading up to race day. Is there any specific advice you'd recommend for supporting endurance, protecting my joints and recovering from those long runs? I'm curious about things like supplements, herbs, or even lifestyle tips that could help keep me in peak condition. We actually did a podcast on marathons.
We did do a podcast on marathons. But let's summarise it for Oliver. Yeah. Firstly, my advice to you is don't do the marathon. It's painful. It's stupid. It hurts. I've done a few of them. I'm an idiot. I admit it. But let's say you're still going to ignore my advice and do it. The very first thing you need to look after are your joints. And you need things like ligament and tendon support and, the gel in your knees. So look for things like there's collagen complexes like Fortigel and Tenderfort, which are very good for your joints, as well as Body Balance collagen, which is good for your muscles. So they go hand in hand. But you feel the points. Now you do get inflammation when you run. So look for things like turmeric, boswellia, ginger to take as regular anti-inflammatories just to tamp down that inflammation in the body. Yeah. And, of course, omega-3 oils that you're a super-duper fan of.
Love it.
And those things are required to help you with your joints and help you recover. Now, when you recover, you can take branched-chain amino acids as well. Yeah. So, look, there are proteins out there with Body Balance, some joint foods with branched chains and glutamine for your gut and all sorts of things. Betaine in there, it's very good for your things. So keep an eye out for those sorts of proteins and they'll help you recover. Yes. So think of those herbs. The fish oils are very good, and there's a myriad of other things you can take, but that'd be my suggestion. What about you?
Yep, all those things. Not a marathon runner, no. But I will give a shout out to my friend who's about to do the New York Marathon. Oh. She's amazing, Rachie. This is probably, she'll have done it by the time this comes out. But anyway, she's amazing. But she would call me and voicemail me while she's running 35 Ks. She's just running for her.
I only take my phone when I go for a run.
I don't know how she does it. She's amazing. Anyway, shout out to Rachie. She's amazing doing New York Marathon.
Right. So that's good on her.
Very cool.
Well, I'll read you one out, Nick.
Okay, you read me one out.
Dave from Mackay. Hey, Nic and Steve, I love the show. Thank you. My wife and I both listen to the podcast. She suggested I write and see if you geniuses can help. Ooh, I'm not making that up.
No, you're not. It's right there.
Every spring, like clockwork, I turn into a sneezing, sniffling mess. My eyes get watery. I look like I've been crying. The antivirus means help, but they also turn me into a zombie, just without the cool apocalypse survival skills. Well, you got a mouthful there. Are there any herbs, supplements, or magical potions that can help you survive hay fever season? Seriously, my nose would appreciate it. Keep up the great work. You guys are lifesavers. Nick, this is right up your alley.
Histamines.
Histamine's the thing that causes vasodilation, causes runny eyes. Yeah. What does Dave do about this?
Well, I'd be looking for the underlying cause of the high histamine. So is it coming from the gut? Is there any hyperpermeability? Is there any overgrowth of histamine-producing bacteria in the gut that's creating a lot of these issues? Are you due to have an imbalance in your immune system? Yep. So that could be a big factor. It could be genetics involved, cellular HNMT issues or that sort of thing. So look for those sort of issues first. Have a look at underlying causes, and then things like quercetin is really good. It's one of my go-tos for antihistamines. It's so good as an antihistamine. It's anti-inflammatory. It does so many things in the body. It's a flavonoid, so it's great. It's good for the gut as well, but very good at inhibiting that mast cell degranulation. Yeah. So, and I have put clients on quercetin that've been on antihistamines and they're amazing, so much better. Nigella seed is a really good antihistamine as well. Yes, it is. Yeah. And you can buy that in stores. You can buy the seeds and put them in your meals. Oh. You can buy the oil if you gain because it's very bitter. Yep. So tasting. Grinders, you can get it. So that's really good as well. Baked skullcap is another one. It's very good for allergies and things like that. Work on the gut as well. Maybe look at, as I said, see if you've got any hyperpermeability or leaky gut. Yeah. But work on the gut and then immune boosting, immune modulating herbs as well. So I'm really getting into the medicinal mushrooms at the moment as immunomodulatory. You better
be careful.
Agents.
Which mushrooms are you talking about? Not the magic ones.
Not the ones you go out and find in the bush. No, things like shiitake and reishi and cordyceps and amazing modulatory herbs. Yeah, they're really good. And then, anti-inflammatory things, obviously your fish oils, I love that sort of thing as well. But quercetin's probably one of my favourites. Yeah. And then also B6 and vitamin C help to break down histamines as well.
Okay. Yeah, of course.
Yeah, and they're needed for that HNMT enzyme as well. So, there's a few little things you could try.
Oh, it's excellent. Couldn't add a thing to it. It's perfect.
Awesome.
All right, Nick, we'll see you next week.
Yeah, if you have any questions, any FAQs,
of course,
put them in below.
Send them in.
Cool. Thanks, guys.
Okay, see ya.
See ya.